Have you ever noticed tiny shapes drifting across your field of vision? These mysterious specks, often appearing as threads, squiggles, or cobwebs, are commonly known as eye floaters. Though they may seem to dart away when you try to focus on them, rest assured they are not figments of your imagination. Eye floaters are a common visual phenomenon experienced by many. In fact, they are so prevalent that you might even consider them a normal part of having eyes. While these floaters can be a bit bothersome, they are usually harmless and tend to be more noticeable when looking at a bright, uniform background, such as a clear sky or a white wall. Our brains are remarkably adept at filtering out these distractions, and most people learn to ignore them over time. However, understanding the science behind these elusive specks can help demystify their presence and offer peace of mind. To understand eye floaters, we need to delve into the intricate structure of our eyes. The eye is filled with a gel-like substance called the vitreous humor, which helps maintain its shape. As we age, the vitreous humor can undergo changes, becoming slightly more liquid and shrinking. This shrinkage can cause microscopic fibers of protein within the vitreous to clump together. These clumps cast shadows on the retina, the light-sensitive layer at the back of the eye, and we perceive these shadows as floaters. Imagine shining a flashlight through a glass of water with small particles floating in it. The particles cast shadows on the surface behind the glass. Similarly, floaters in the vitreous humor cast shadows on the retina as light passes through the eye. The movement of these floaters, often described as drifting, bobbing, or squiggling, is simply a reflection of the fluid dynamics of the vitreous humor. While they may seem to have a life of their own, they are merely following the currents within the eye. While eye floaters are the most common cause of these mysterious specks in our vision, another phenomenon, known as the blue field entoptic phenomenon, can also create similar visual effects. However, unlike floaters, which are caused by shadows cast on the retina, the blue field entoptic phenomenon is a result of our own blood cells moving through the capillaries in front of the retina. Imagine looking at a bright blue sky on a sunny day. Have you ever noticed tiny, bright dots darting across your vision? These fleeting dots, often described as resembling a swarm of tiny flies, are actually white blood cells moving through the capillaries in your eyes. The blue light illuminates these cells, making them momentarily visible against the bright background. This phenomenon is entirely normal and harmless, and it highlights the intricate network of blood vessels that nourish our eyes. While most eye floaters are benign and simply a natural part of aging, there are instances where they can signal a more serious underlying condition. A sudden increase in the number of floaters, especially if accompanied by flashes of light or a loss of peripheral vision, could indicate a retinal tear or detachment. These conditions require immediate medical attention to prevent permanent vision loss. If you experience any sudden changes in your vision, such as a dramatic increase in floaters, flashes of light, a curtain-like shadow obscuring part of your vision, or any other unusual visual disturbances, it is crucial to consult an eye doctor immediately. Early detection and treatment are essential for preserving vision and preventing long-term complications. Remember, your vision is precious, and it is always better to err on the side of caution when it comes to your eye health.